So, in this DT-based delivery series of biology for engineers, today's topic is typhoid. So, typhoid is a bacterially transmitted disease which spread through a contaminated water and food. So, what is a basic definition of typhoid?
Typhoid is a bacterial infection which is caused by the Salmonella Typhi, and it is also called as enteric fever. It is caused by contaminated food and water. Moreover, it is primarily damages your intestine as well as your bloodstreams. And when the typhoid comes, you have to go for checking as soon as, because as I said before that it may damage your intestine and the bloodstream, and also it may weaken you, and you can prevent this from being good hygiene and as well as drinking water and with the proper vaccination. And it is mostly caused in the poor area where the sanitation is not done.
So, what is the causes and symptoms of typhoid?
Causes is about the bacteria and is called Salmonella Typhi, and it commonly spreads the poor hygiene and closely contact with the infected people, and also contaminated of food and water. And symptoms of typhoid is headache, a loss of aptitude, and it causes the skin rashes.
So, any other points?
Typhoid spreads from person to person, but not direct contact like coughing or sneezing. It spreads by when we consume food from an infected person. It spreads.
Typhoid fever can be very serious. If left untreated, it can lead to complications and even be fatal. Typhoid fever is a bacterial infection caused by Salmonella Typhi, and while it can be treated with antibiotics.
What are the risk factors of typhoid? The vaccines that to be followed for typhoid.
Typhoid vaccines. Typhoid vaccines such as typhoid conjugate vaccines, which is safe for the children as young as 6 months, and for up to adult of 45 to 65 years of old. And then VI capsular polysaccharide, which is safe for age of 2 years and older. And then last live attenuated vaccine, which is a oral tablet, which is directly injected to children of 1 year of age and
So coming to a collective of all these information, so typhoid is so in typhoid it may affect the internal organs of our body. So which part is the major affected part in typhoid?
Typhoid is caused by Salmonella Typhi. The major organs affected by typhoid is intestines, especially small intestine, which leads to ulcer, bleeding, and gallbladder is the another organ, and liver and spleens, and bone marrow. In that, it causes the reduction of blood cells and also the blood cells.
So what are the foods that need to be intake during the fever?
The typhoid diet said to take the foods, soft foods, rice kanji. Said to eat soft foods, porridge, upma, khichdi, and coconut butter, bread, potatoes. They are to avoiding foods oily, spicy, and fried rice, non-veg, alcohol, soda.
First effective vaccine for typhoid fever developed by Alfred Edward bacteriologist in 1815.
So, coming to the conclusion, the points we have discussed above is that the person who is affected with typhoid can take rest, vaccine, and tablets so that it increase the risk of death. So, typhoid can be in quarantine so that it will reduce the risk of spreading of the diseases.